Good evening. I want to extend a warm Hokie welcome to our alumni community members from all over the country tonight, including Alaska. Thank you for joining our first Hokie Talk of the season, Virginia Tech's COVID-19 response, science and engineering in service to community health. The purpose of Hokie Talks are to engage audiences with faculty in their research. Not just any faculty, but extraordinary faculty who are making a difference in our daily lives and across the globe. There will be a total of 4 throughout the academic year. Please mark your calendar for our next Hokie Talk, which will be held on December 8th, and will also feature Virginia Tech's COVID-19 response, but from a social science and policy perspective. Tonight's Hokie Talk is in collaboration with the College of Engineering, the College of Science, and the Fralin Biomedical Research Institute. We would now like to turn our attention to Dr. Michael Friedlander, who will start the conversation for us this evening and also serve as our moderator. Dr. Friedlander moved to Roanoke from his neuroscience leadership role at Baylor College of Medicine in Houston with his wife Sandra in 2010 to become the inaugural executive director of the Fralin Biomedical Research Institute at BTC. In addition to serving as the Institute's executive director and the senior dean for research at the Virginia Tech Carilion School of Medicine, Dr. Friedlander was named Virginia Tech's first vice president for health science and technology in 2016 to spearhead biomedical science research across the university and to lead the development of the VTC Health Sciences and Technology campus. Among his honors and recognitions, Dr. Friedlander is an elected fellow of the world's largest scientific society, the American Association for the Advancement of Science. He's a recipient of the William Menninger Award for Distinguished Contributions to Mental Health Research and a distinguished scientist of the Society for Experimental Biology and Medicine. Dr. Friedlander recruited some of the world's most creative biomedical scientists to Roanoke, leading the city's storied transformation from train town to brain town. He has been at the forefront of Virginia Tech's efforts to develop the university's COVID-19 testing capability. Dr. Friedlander, I leave the program in your capable hands now.
Thank you very much, Debbie. Thank you for that kind introduction. I'm going to demask now that I'm alone in my office here. Welcome, everybody. It's a pleasure to have this opportunity to share with you this wonderful panel this evening. Before we get started, let me just set out some ground rules for the evening. The program is to run about an hour, and we'll be respectful of your time. We'll have the initial panel discussion for approximately 45 minutes and leave 15 minutes for questions thereafter. Meanwhile, if anybody has questions, please put them in the Q&A. I'll be looking at them as we go along, talking to our panelists, and then at the appropriate time, open it up and I'll read the questions to the panelists. So let me start by introducing the other 3 members of the panel. Dr. Carlo Finkelstein, who's an associate professor of biological sciences and here also at the Fralin Biomedical Research Institute. Dr. Finkelstein is also the director of our Virginia Tech Molecular Diagnostics Laboratory that you'll be hearing more about. Her own research is as a cancer molecular biologist who studies breast cancer, circadian control of cell proliferation, and the effects of shift work. Our next panelist is Dr. Harold Sondheimer. Dr. Sontheimer is a professor of neuroscience and also here at the Fralin Biomedical Research Institute, and he was the founding director of Virginia Tech's School of Neuroscience. Dr. Sontheimer's research as a neuroscientist focuses his work on the brain's glial cells, and there are many important roles in brain development, aging, disease, and cancer. And then our third and final panelist is Dr. Chris Williams. Dr. Williams is professor of mechanical engineering and director of the Design, Research, and Education for Additive Manufacturing Systems, or what's called the DREAMS Laboratory. Dr. Williams' research as a mechanical engineer has a passion for additive manufacturing, particularly 3D printing, design, manufacturing, and methodologies, and also for engineering design education. So as you can tell, we have a great panel tonight. I think it's going to be a lot of fun. So let me start by asking everybody to go back 6 or 7 months in time. Remember that time of year in early winter, midwinter? We had the Super Bowl that was over. We had basketball season coming on. The Hokies were winning some big games at the time. We had Groundhog Day, that dividing point going from winter into spring or looking for how much winter is left. And the world seemed reasonably normal. All of a sudden, everything changed for all of us. And like all of you and everybody out there, people at Virginia Tech, Hokies decided, this is something we have to do something about and address. And I think in the quintessential spirit of Virginia Tech, of ut prosim, every one of the people here you'll hear from definitely did that. But as important, a lot of people you won't hear from tonight had a lot to do with everything that went on. And we simply don't have time to name them all and bring them here, but take it from me, take it from the rest of our panelists. Many faculty, many staff, many students, leadership up and down the chain at Virginia Tech had a lot to do with bringing all these things to fruition. And I know I speak for my colleagues by saying we all couldn't be prouder than to be part of this Hokie family. So again, I set the stage, things changed, the pandemic hit. We knew there was a problem. We also knew early on that the tests that were being put out for COVID were not matching the need at the time. And there were issues and problems, and we're going to hear a little bit about that. Another thing we all heard a lot about, of course, was a potential shortage of materials and instrumentation, equipment, et cetera, that might be needed in hospitals to help support people that were becoming very ill from COVID. And so in response to those two major groups of needs, the folks on the panel tonight got together, organized their programs, walked away literally from their day jobs and their research and everything else that they were doing, and with a passion, a dedication, and a real expertise that you bring to bear from someplace like an academic research-oriented institution like Virginia Tech, they shifted gears completely and pivoted, as the word is used very much, to work on these problems. So we're first going to hear a little bit about the COVID testing operation. We're going to hear from Dr. Finkelstein and Dr. Sontheimer and what they stood up and were able to do. And I'll share a little bit of that because I had the pleasure in the background to work a little bit on some of the issues with regulatory and so forth. And then we're going to hear about the engineering components in our engineering school and the number of people there that tied in with the clinical operations here in the New River and the Roanoke Valleys, particularly with our partners, Carilion Clinic, and some of the things they were able to do to bring some of these things to fruition that has had so much impact on the community. So before I turn to our first panelist, I just want to share one picture and one slide with everybody that I will try to do right now. And this particular slide is a picture that shows a histogram of different dates going all the way back to late April and going right up until a couple days ago, or yesterday, as a matter of fact. And it shows the number of tests for COVID-19 or the SARS-CoV-2 virus that the folks here, excuse me, were able to do over the last few months. And simply the graph shows in gray all the tests that have been run for the health departments in the area, and in orange the tests that were run for Virginia Tech, primarily for Virginia Tech students. And as you can see in the inset, almost 35,000 tests have been run since inception, about 18,000 for the health departments, about 17,000 for Virginia Tech. And I think you can see the increase that has happened over this time. So this is just an example with the numbers of the rapid way this group stood up these tests, got them going, got them approved, and deployed them in service of the community. So with that as a backdrop, I'd like to first turn to our panelist, Carla Finkelstein, and ask Carla to tell us a little bit how she moved from what she was doing in research, in particular, how she focused on this particular test that she developed that you're going to hear was really a very cool way to develop a test that wouldn't necessarily be as susceptible to some of the issues like supply chain issues, and was very precisely targeted to get the best answer from the COVID testing. So Carla, tell us a little bit about how you did that.
Okay. Well, first of all, I would like to thank Debbie and Mike for your kind invitation. It's really a pleasure to be here with this really a group of distinguished panelists, Harry and Chris. Really, I admire their work tremendously, so it's a pleasure to be here. Second, and before I answer your question, I really want the audience to think that don't see us, don't see me, Harry, or Chris. We are a team here. There's a team behind us. There's a team that helped us to do everything that we have accomplished so far. I cannot emphasize that enough. It's never one person, and it's a team, and it goes from undergrads to upper administration. So please, it's not just me or any of us. So I think Mike did a really good summary of the whole process in general. The devil is in the details, really. There are a couple of things that relates to the testing that were particularly important. And what I'm going to try to tell you is what we did, how we did it, and why we did it. And what Mike says is absolutely true. I mean, really, we were comfortably sitting in our labs doing our research, and really the pandemic hit. And some of us, we cannot just simply stay in our comfort zone for much longer. And we decided to help. The problem that I had, and that's probably what happened to my colleagues as well, is that, I'm a molecular biologist, right? I mean, I'm not a physician, I'm not a nurse, I'm not someone that was required immediately. So how can I help, really? I mean, it was really something that I struggle a lot, because I want to really help in these times, and I couldn't find that my expertise was useful in any way, until really we got this kind of punch in the stomach when we found out that we couldn't do testing because there was not enough supplies out there, or the tests were faulty. So then I was like, well, I know something about molecules, so maybe I can help on that aspect. And really what we did initially was to think about what would be the best possible test that we could develop with the resources that we have on hand, okay, that make us independent of any potential supply chain. So when you create your wish list on any potential test, you put everything that you want, right? So I mean, if I had the opportunity to develop a test, what I would do? Well, I would like to have the most sensitive possible test that at least is as sensitive as anything that is in the market, okay? That is specific enough so it won't recognize any other respiratory virus. It will recognize coronavirus, and it will do it better than any other coronavirus test, because it will avoid false positives and false negatives. It will be, or it should be, easy to implement or deploy to whatever region that we needed to do it. Ideally, you want to have a short turnaround. Everybody was hearing about, tests that takes 10 days to get results back and everything. We just want to have something that can give us the results like this, so we can pass the information to the epidemiologists and they can start contact tracing and try to contain any potential infections. We also want to have a flexible kit, I mean, by flexible, I mean something that it won't depend on one particular supply chain. If this is not in the market anymore and we need this other kind of plastic or this kind of reagent, we can switch, and then would allow us to actually maintain the testing ongoing. And then ideally, you want something that is inexpensive, or at least not as expensive as things that they were in the market at that time. So we came up with some ideas on how to do this, and there was an early publication in the VT News that we developed this initial test. And I had to confess that I just got tons of emails from my colleagues, former students, current students at all levels offering help. And they told me, well, look, I do XYZ. If there's anything that we, with my expertise, with XYZ expertise, can do to help, I'll be very happy to help. And I remember at that time I created an Excel file that has, okay, John Smith has this expertise, this other person has this other expertise. And I thought, well, if at one point we need this expertise, I know that he sent me or she sent me an email, so I can always go back. And in fact, some of those faculties might be watching this, and they know that I went back to them, especially when I needed to answer to the FDA questions. So anyway, with that on hand, and that kind of dream, it really everything crystallized when Harry jumped in and his group. He has a fantastic group of graduate students and postdoc that were fearless. They really jump on the idea of doing the testing and helping and moving this forward. And we start doing testings in a way that, I don't know, maybe I shouldn't say it here because I'm not sure everything that we did was okay, but we did it ourselves, and we did a lot of very in-house stuff until we managed to put things around. And sometimes we didn't have all the supplies that we needed initially, and we needed to beg other people to give us a few things, but we eventually managed to go around and came out with a product that was good. And we were very happy. And then is when you reach what I call the inflection point. The inflection point is when you have this potential transition of something that you develop in a lab and you want to move it and make it massive for our whole community. I was just out there thinking, if we are here in the middle of Blacksburg, okay, and there is a pandemic that hits the whole Southwest Virginia, we're not going to have enough beds in the hospitals. We're not going to have enough supplies out there to cover the necessities of our community. So we need to actually find a way to move whatever we manage to accomplish in a small scale to a much larger scale. And this is where partnerships with the Department of Health has been critical. But more importantly, and I really mean this, having a very proactive administration. I mean, the university did something that no any other university that I know have done. I mean, they jump on the idea of serving our community, and they were really eager to help without any particular, boundaries. I never had anything like, okay, Carla, we can help up to here. It was never that. We never reached that ceiling. There was continuous pouring of help all the time. And when I'm talking about help, I'm not talking about small help. As you can imagine, if you want to move from here to here, okay, there's a substantial step that we need to pass. And that substantial step was we needed more scientific expertise, of course. We need better facilities. We needed IT support. We needed legal and regulatory expertises around. And I don't have any of those expertises, to be honest, beyond the scientific one. So when the university commit all those resources is when really we move from a handful of tests per day to the operation that we have today on the molecular diagnostics lab.
Thank you, Carla, very much for that. So really good opening. So Harry, Carla mentioned how your team jumped in. And one of the things I'd like to ask you to address is how are you able to identify and recruit all these wonderful people? You have graduate students in your lab, undergraduates, postdoctoral fellows, research technicians, and were they really prepared and trained to step into a role like this? And how did you pull that team together across the campuses?
Well, Mike, I don't think I've ever seen anything like this, and I couldn't be prouder than what happened in the second week of March. As you know, we're an institute of higher learning. We have learners at all levels, undergraduates, graduates, postdocs, and we do research, and we do it for two purposes. We do it to understand disease processes. In my case, it's epilepsy, Alzheimer's disease, brain tumors, but we also do it to teach people how to use current methodology. We were flabbergasted, I in particular, about the unpreparedness of our health system to respond to this crisis, the inability to deliver what I would consider a relatively simple test. I remember March 15, I walked into the lab and I talked to my people in the lab, 15 of them. I says, how hard can it be? Who can do PCR here? That's something we do. That's the methodology with which you detect the virus. 8 of them said, well, we do it all the time. We do it every day. That's what we do for a living. But you know what? Typically, we do that to get an understanding of disease processes where we hope to have treatments 10, 20 years from now. The idea when I floated to them, could we do this? Could we? And everybody says, how hard can it be? The excitement about being able to put science to the task today to help people today and tomorrow, as opposed to 20 years from now, that was the key motivation. Super science hero. All of a sudden, all the training you got actually had meaning. And the samples we got in, they weren't from a mouse or something. This was someone's grandmother. This was someone's father. And that's how we treated these samples. They couldn't wait. We needed answers. When we had the first delivery of outbreaks from an assisted living facility, and we saw all the positive samples, no one would leave until we were done. However inconvenient to this day, the time is when samples come, they get processed and done because we're not a for-profit lab. We actually do this with the passion of making academia work for our local community here today. And that spirit has carried into the great facility that Carla has scaled up with over 20 people, many of who are actually former learners, former students, former technicians at Virginia Tech. It's not rocket science, but what we pulled off is amazing. And I think Carla doesn't do quite justice to what happened. March 15, how hard can it be? April the 25th, we did the first clinical test for the health system. That is 5 weeks. And in those 5 weeks, those people were working day and night, 24/7. And they were sourcing, like my technician went out, sourcing all the plastic, all the chemicals, everything we could possibly need. They scoured papers. We made calls to South Korea, to friends, to figure out why are these primers from the CDC not working? Well, here are better ones. We had Tom Maynard, one of our own faculty, stepping in. Let's make better primers, make our own. We now have probably the 3 best primers. And yes, we use 3, not 1. That's why our tests are so accurate. I couldn't be more proud as the development that was put in place by people who are still at a stage of training. Admittedly, postdocs have had a lot of training, but the excitement that they brought to bear was just unbelievable, and I'm so proud of them.
Thanks, Harry. I think you really captured the essence of the spirit of all these folks, including yourselves and Carla and your teams very well. Thank you very much for that. Let me now turn to Chris. So on another front, besides the testing, as I think everybody knows, there was a lot of concern. Would there be enough PPE? Would there be enough ventilators? Would there be enough instruments to do the various things that be needed for life support? And one of the things that Chris was dealing with was the connection between Virginia Tech, mostly the Blacksburg campus folks in this case, and our partners in the clinic, physicians at Carilion Clinic. And I had the opportunity to try to facilitate some of those connections. And then Chris took it from there, and his team got together and started, as you'll hear, producing incredible things and assembling a team as well, and including a lot of undergraduate students who contributed to this. So tell us a little bit about that, Chris.
Sure. Yeah. Well, like Carla, I want to start by just thanking, for the opportunity, but also to note that I'm really just representing 75 faculty, students, and staff, and plus the entire New River Valley region, who all got engaged in this effort to produce PPE for our local health system. So I'm just a representative. I'm carrying the message. I'm definitely not the sole person here. So to answer your question, so March 11th was when the university closed. And I was getting phone calls from my friends at hospitals in New Orleans and New York and DC, and they had seen stories from Italy of folks using 3D printing to maybe find a way to sort of fix the supply chain gap. And so I also got phone calls from other hospitals who were looking for expertise in 3D printing to sort of get my advice on whether or not I thought it was safe. At the same time, as you mentioned, Mike was extraordinarily helpful in connecting us to the local community. And again, to hear exactly what their needs were and their perceived needs. And I can tell you, there is nothing more scary than hearing a medical professional express their fear and concern for their own safety. Who cares for the caregivers? It's something that we don't have to think about very often. And at the same time, I'm hearing along, through the hallways, if you will, that my colleagues around the campus were also looking at using their own 3D printing equipment to potentially fill this gap. And as Harold mentioned, just generally, I think we were all frustrated by well, maybe we all had a strong desire to help, but also a bit frustrated by a lack of just any coordination of any type to sort of improve efficiency, to disseminate a single correct answer, whether that was of any type. And so we were seeing, lots of people coming with ideas of how to 3D print PPE, lots of different designs every day, someone trying to reinvent the wheel. And I just got, as an engineer, you get frustrated by inefficiencies. So, fortunately, there's a culture of collaboration here at Virginia Tech that is just unlike anything I've seen anywhere else. And not just any collaboration, but interdisciplinary collaboration. So within a few days, we had organized a meeting of about 50 attendees that spanned every college at our university and multiple, of course, departments. And it's not just engineers who have 3D printers. It's, people from geosciences who use 3D printing to make their components. It's, of course, our friends from Vet Med. And as Mike mentioned, it's all of our new friends, to me at least new, in our new medical school, the faculty who work at VTC and at Virginia Tech to provide their expertise. And that coordination, that sort of getting everyone's information, everyone's customers, if you will, everyone's needs, is what really helped us then designed together single answers for lots of different problems. We addressed 13 different needs that Carolian and our local and other local medical professionals expressed, whether that was, making face shields, making N95 respirator replacements, making, viral shells for their, for their filters to ensure everyone's safety. And I think that's the real key to the success of our effort, was leveraging the broad expertise at Virginia Tech, whether that's, science and chemistry, engineering, material science, manufacturing, sterilization, virology, aerosol transmissions, right? Leveraging everyone's resources and expertise to come together to come up with solutions. At the end of all of this, so it was March 11th was when everything closed. I think it was March 27th was when I got to go to Roanoke to visit the doctors. Dr. Ed Rubio is the chief pulmonologist, to talk to him about his specific, not only his needs for equipment and supplies and his nurses' needs for equipment and supplies, but also his innovations, his ideas about how to, for example, convert sleep apnea machines into potential respirators, and the needs of the technologies that would be needed to support that. It was March 31st was our first meeting, and I think we delivered our first face shields within about 10 days. At the end of 2 months of effort, we delivered 6 with the help of the entire community, who 3D printed face shields and delivered, and just sort of, we crowdsourced that manufacturing effort. They brought all of the, they used their own 3D printers and brought their products to campus. We sterilized them. We brought them to Roanoke, where they were then assembled by the medical school students and then distributed to the health professionals there. We also made 250 of these oxygen therapy components to help the nurses there with their idea of how to connect different components together for their respirators. We delivered 300 of these viral filters that are reusable, that are currently used in some local EMS here. And we also have on the sort of bench, when it's needed, an N95 replacement respirator, all manufactured here, which is the capabilities that we have at Virginia Tech, by grouping everyone's resources and expertise together. So yeah, it was a real outstanding effort and quite a learning experience for everyone involved, including, of course, our students.
Thank you, Chris. Chris does a great job of giving credit to lots of other people, just like our other 2 panelists. But I just want to say, as Chris knows, I was on a few of those early calls he was having in meetings with people in the early days. And Chris himself was just a force to reckon with. Your organizational capability. I mean, you came at the whole thing like an engineer. Next thing I knew, there were like 15 groups meeting on Slack meetings. I couldn't keep up with it. I had to bail out. So yeah, pretty impressive. If I might, I'd like to just continue on to what all 3 of you said in terms of acknowledging people that really made this happen. And of course, we talked about our faculty colleagues, your students, the staff, postdocs, technicians. And one group we haven't mentioned so much, and they don't get mentioned that often, in my opinion, but in this case, it was really important. It was really the top leadership of the university. Everything you just heard about costs money, and costs a lot of money. When I showed you that first graph there with the tests, for example, that started out, hitting maybe 100, 200 a day and got up in some cases over 1,200, we're talking between $50,000 and $125,000 in a day just for the supplies used for those tests, let alone personnel and instruments and so forth and so on. And I suppose it's obvious, but I'll state the obvious. We didn't have a bucket of money to do that. We had our operational funds for our units, for our departments, institutes, et cetera. And I remember turning to President Sands and Provost Clark and telling them what was going on here and saying, how do we pay for this? And I'll never forget the answers I got, which were, don't worry about it, we're going to pay for it. This is important. This is what we do at Virginia Tech. And every night I would go to bed wondering when that bill would come due. Well, the good news is the university has, of course, taken care of all this internally. And since then, we've reached out for help to the state and so forth, and starting to see some support there. So, but I think our leaders having the courage to do that and make that pivot. And without that support, I was fearful that I'd have to wake up one day and call Carla or Harry or Chris and say, there's no more money to do this. But that never happened. It never happened. And another group I want to mention is the legal team at Virginia Tech. Again, a group you don't hear a lot about, working behind the scenes. Lawyers don't like to hear their names mentioned, but I'm going to mention one, Kay Heidbreder, Chief Legal Counsel at Tech. I cannot tell you how many calls I had to make to her dealing with regulatory issues, working with the FDA, the State Health Department, working with the local health districts, our Schifferett Student Health Center that the testing came under. These folks are absolutely terrific. And so it really did take a village, and it was a team effort all the way. And I wanted to make sure to mention some of that going forward as well. So perhaps at this point, we could take some of the time and say a little bit more, Carla or Harry, on the testing. Either one of you, please feel free to jump in. You described the initial test and the really ingenious, I think, way that you approached it to set it up to be very resilient, very robust test that we have. But you've also done a lot of other things along the way in developing other aspects of how we use the test, how we can collect samples, pull samples, different collection methods, wastewater treatment, working together with the engineers and that group. Would you say a little bit about where we've come since the earliest days with some of the other additions to testing?
Yeah, the original idea was use nasopharyngeal swabs. And that worked very well, actually works fantastic, and is kind of the standard that everybody uses these days. We found out that our test was pretty robust if we use different specimens. So we went from NP swabs to use even saliva these days to detect the virus. So it's very sensitive in that way. So it's good if you have, if you consider that the saliva testing can be used with kids, for example, with small kids. They are not very prone to have their noses with the swab inside. Also with elderly people. That's great. Then we have another development, which was the idea of, and this is an idea that we work with Harry a lot, and we tried to push it at the beginning with some resistance, but then eventually everybody liked it, the pooling part. So we thought that, if you pool samples, you can analyze a cohort at once. Let's say, for example, you can analyze a whole family, let's say, in just one sample. You can just get samples from each of them, pull it in one, and do the test for that one single sample. And if that sample is negative, then you can rule out that everybody in that family is negative. If that sample comes back positive, then you grab every single one of those individuals in the family and test them individually and find out which one is the positive. Nowadays, the FDA has actually authorized us to use those new modifications, and we have done some pooling for really large samples, and the sensitivity is fantastic. It's equally good as the single sample, and the saliva is really pretty handy. It's very easy to implement. So I don't know, Harry, if you have any other comments on that. I mean, we were the ones champion the most.
We preceded all the news releases. We talked about pooled samples long before the New York Times talked about them. We talked about the saliva sample and had them implemented long before the New York Times. And actually the wastewater testing that you are involved with now, of course, we're involved with the tech, and we started doing that again pretty early in the game.
Yeah, I think both Harry and Carla pointed out something that I've seen working closely with them, is this team, of course, stood up the testing, keeps it going, but they never stopped innovating and never stopped doing research in parallel to see how to improve this test, improve capacity, and so forth. And the other thing they've done is stayed in constant communication with the local health districts in the New River Valley and in Roanoke, Allegheny, and lots of other health districts. And again, reminds me, a backdrop here we haven't heard much about, but Hal Irvin and his team and the people that have been involved with the lab with communicating with the health districts and making sure there's a proper flow of materials coming in and out, the number of tests, working with Schiffert at Virginia Tech, just an enormous group on the back end as well, making sure this runs smoothly. Hey, Chris, we just heard a little bit mention anyway about the wastewater treatment, the wastewater sample analysis. And I know that's not your particular focus area, but other folks in engineering have been involved with that. And that's a great example, I think, where the sort of things being done on the engineering side and the biology side have come together. Can you say a little bit about those connections from your group?
Yeah, of course. And I think, again, I speak again to that breadth of expertise that comes with being a part of a comprehensive research university that really makes it such a powerful, opportunity. And the example I'll share is actually, Carla mentioned that, the nasal swabs. Early on, actually, Carla was one of our customers, right? We had talked to all the doctors about what they needed, but Carla showed up with, we got to hear her vision. And this is very early on. And she attended our meeting as someone in need and saying, we can't find any nasal swabs. That supply chain was also broken. And, can you find a way to 3D print those? And Mark Michel, who's a professor in geosciences, who is a nanoscientist, if you will, who uses 3D printing daily, volunteered to lead that project. And as a result, he found an existing design that he was able to bring to Virginia Tech. He found a way to 3D print those nasal swabs. And then along the way, in addition to the sort of rapid engineering of creating a production process to mass produce these, he also reached out to our scientists. In this case, they are the engineers. So David Dillard, an engineering mechanics professor, did a lot of tests to ensure, along with Michael Bortner in chemical engineering, to ensure that these nasal swabs are actually stiff enough and safe to use. They wouldn't break off while being used, right? So we're doing rapid science to ensure quality, doing rapid engineering to ensure production capacity. And then we're also collecting. We went around and we, thankfully, again, a collaborative group, we knew who on campus had that exact model 3D printer and got their commitment, right? Their labs are shut down. They all want to help. We got their commitment to bring their personal, printers from their labs all together in the safe space, in the building there that Carla's working in. And so I think it's that rapid engineering and rapid science together to enable all of this innovation that we're talking about today.
Yeah, I just want to acknowledge that the whole idea of crystallizing the project of wastewater came from the folks on the environmental and civil engineer, Peter Bickersland and Amy Pruden, who actually kind of recruit me as the one that was doing the test to see if our test will be robust enough to identify the virus in wastewater. And I was like, oh my gosh, you're really asking for a miracle because there's any kind of junk in the wastewater. I mean, it's going to destroy the RNA, and I don't know how we made it work, but it works very nicely. And actually, I think it's a fantastic idea because that has been implemented in Europe first, that allows for the identification of areas where you have positive samples. So you can isolate a building and say, okay, the wastewater that comes from this building implies that people that lives in this building is infected somehow. So then you can just isolate that particular community and test the community separately. So it's a very clever way to rapid identify areas of positive individuals, where positive individuals live.
Yeah, thank you, Carla. So look, we have a few more minutes before we get to the time we've set aside for questions, but I wanted to give each of you a chance to comment on something that we've talked about ourselves. All this work, all this effort, all this contribution that you and your teams have made up to this point. So going forward into the future now, we're going to get by this COVID thing. We're going to do it at some point, but who knows what lies out there in the future, the next pandemic, other things, so forth. So what have we learned? What might we do different, or what could we do to take everything that you all have done here and really build for the future instead of just disassembling our networks, our facilities, the people? Is there something we might think about in terms of partnership with our community, our government, the neighboring communities, other universities, health systems? What do you think? What do you see in the future? Any one of you?
I'll go first. I would say communication is key. I want the community to know that we scientists actually have skills that are useful. And that's not just us professors who are the face here. It is the people that we train. We train them with skills that can be used today, that can be deployed in just about any epidemic. Just about all the life scientists that we have at Virginia Tech across the various colleges, whether they're undergraduate or graduate students, they have skills that could be readily deployed if the next epidemic like that hits. And so I think by communicating this, we're also going to instill greater self-confidence in those that we train. They're now recognizing that, oh no, I'm not just working on a problem 30 years from now. I actually have skills that I can deploy here and now. And I think that's very important to communicate.
I think, Harry, you make a really good point. We're an academic institution, but everything that's done here is not just academic. It has real world applications. Right?
But I do want to point out that being an academic institution gives us the agility that you hear through all these conversations. We can quickly reach out to Chris. I can reach out to Carla. We can solve problems together. The kit that we prepared with these 3 primers, if the virus mutates, we can change within a day. We can adapt to that in a hurry. And yes, we may not be able to scale to 1 million tests today. I don't know who can, but we have the agility to respond to a specific problem here and now. And I think you can almost only do that in a highly collaborative academic institution.
Yeah.
Oh, thanks, Harry. Carla, you wanted to add to that?
And I just want to say that now we have a molecular diagnostics lab here set up. I mean, we are already in good shape for anything that comes after this, and hopefully nothing comes after this, and we can just do some standard testings and keep monitoring and surveilling the region. But now the southwestern part of Virginia has a center that they can trust on and they can deliver. So I think that is important for the community as well.
Good point. Chris, would you like to comment on it?
Yeah, so I'll start specifically and talk about, what we learned from this on the engineering side is really that our nation and many nations need resiliency in their supply chains and in their manufacturing processes. And fortunately, there's a future ahead of us, and the future starts now of a digital revolution in manufacturing, which has been ongoing for a long time, where we can truly make a resilient network of manufacturing to provide the agility needed to address any emergency that arises. And what we really learned through this, and we've been talking about that for, in our communities for a while, but really this was the time in which we implemented it. And to Harold's point, the key here is that resiliency occurs through collaboration. It does not occur through competition. And I think our university showed that. That's how you rapidly adapt to problems. And that's how we as Hokies solve the big problems of our community and of our community's future, is through our interdisciplinary collaboration. And I think our alumni are products of that. We're really proud of what they've accomplished. And I think our future students got to learn that in a really serious way. Sometimes I wish I could replicate it for my students in the future, although I never hope I have to, but it was such an amazing learning experience for what, those students got to experience, of how you quickly iterate, you work directly with customers, you don't compete, you collaborate, and through that, you can accomplish amazing things.
Yeah, good points, Chris. And I should add, based on a few things each of you said, you all know, but I'm not sure our friends on the call all know. We've had several visits over the last few weeks or so from national leadership in these areas, including Dr. Deborah Birx, who came from the COVID task force from the White House. And then a group came from Health and Human Services and the CDC and the FDA, called a CRAFT group. And anyway, they visited and looked at the facilities here and had a presentation about all the work Chris's groups have been doing, and saw the lab where Carla's working and so forth. And they were extremely impressed with what they saw. They said very nice things, very complimentary things about Virginia Tech. They said there were very few other universities they've seen in the United States where they saw this level of success at dealing with this. And I think that's largely attributable to the people we have right here in this panel, and to the culture and the whole Virginia Tech spirit we've heard so much about. So, all right, well, look, we have about 14 minutes or so, and we have some questions. So I'm gonna pop these questions up here. One question, it's not directed necessarily to anybody in particular, so anyone you could take this. Says, did you have any problems obtaining materials and supplies? Anybody want to grab that? There's a lot to say there, I know.
Little things like pipetters, when we're equipped to do 6 samples, that's what we usually do in a day. If you have to do 1,000 and you need to have 20 people, all of a sudden, what you could usually buy on the free market. No, there were no pipetters. There are no pipette tips. Everything was missing because everybody else was buying it up. We had a person literally be on the phone with all vendors that are out there on a constant basis. And you remember how you blasted out emails for us saying, does anyone have a multi-pipetter, 1,000 milliliter? And people came out of the woodworks. We constantly traveled from lab to lab, and we still have borrowed equipment and borrowed supplies. But that's, again, it speaks to that community spirit. Everybody essentially said, you can take my whole lab, take anything you want, just walk through and take it. Yes, there were a lot of supply shortages.
A very good example was also when we needed to collect N95 mask. There was an email sent to the whole community and says, we need N95 mask now. And the people at the hospital and people in Carrillo needs those N95 masks. And pretty much every single lab that was at that time shut down operations, gave all the N95 mask away. So no, honestly, the answer is yes, we run into some initial hurdles. And I think some of those initial hurdles is because we switched the operation from a small scale to a very large scale pretty fast. And I think we didn't really have the whole infrastructure for that change. And we needed to accommodate the pieces. But no, now that we reached that level and we have some automatized systems, we have a very nice, very powerful robots. we are in much better position. And like I said before, one of the beauties of the system that we use is that it's very flexible. It really allows for exchange of different materials. So if this is not in the market, we can get this other thing. If this is not in the market, we can go this way. There are ways to go around the problem. Like I said, the test that we design is not rocket science, please don't take me wrong, but it's certainly one that works, okay? And it works under these circumstances, and even if we have the minimum material.
Yeah, Carla, I'm not sure how many people know, and I'm not sure we've actually said it, but I want to remind people, even though you're handling sometimes 500 to 1,000 plus samples in a day, you're still turning those around generally within 24 hours. As a matter of fact, your time in the lab, sort of 6 to 9 hours or so, there's the time to come in and report out and so forth. But it's pretty amazing what you all have been able to do and keep that time tight. Chris, you wanted to comment on that?
I was going to say, it's an interesting part of the challenge of creating, we were addressing shortages of materials, but facing our own shortage in raw materials to make those, items. And again, it's just really a moment to, again, thank the administration and, that provided resources and provided us, a case to go find those raw materials. And then we actually purchased raw materials, in this case, 3D printing with, filament, and then distributed it for free to all of the students who wanted to help. So we were addressing their own shortages, again, through this coordinated effort. And that was an important piece. We also want to acknowledge our local companies that partnered with us. Actually, a local company just outside in Floyd actually makes the filter material for N95s. And we actually were able to acquire that, it's not in the mask form, but we're able to use that for these respirator pieces too, right? So actually leveraging every possible resource we could find to address, the shortage of raw materials, to address the shortages of PPE.
Yeah, thank you, Chris. And somebody just asked, I guess I should take this one about the funding. I had mentioned it and how the university was funding this, but they asked if we were able to get any other funding. And so I do want to mention, first of all, there's an organization called Go Virginia that is for helping develop jobs throughout the state. And they responded very quickly to an emergency request, particularly around workforce development, which is what Go Virginia supports. And they supplied us with some money at the very beginning, and then later a larger sum as well. And that helps us to hire and bring on board and train people in the laboratory approach as well. And then, as I said, more recently, the state has been working with us as well. So at the beginning, we couldn't wait. We just went, but things are looking better in that regard. I have a couple other questions here. Let's see, Carla, this one's for you. They ask how many samples can be pulled together, and is there a limit, and why?
Yeah, I was just typing the answer to Mr. Newey. Actually, we pull 4 samples. And yes, there is a maximum, and the maximum is 4. If you go above that number of samples, you run into the problem of having a false negative. So we did all the statistical studies, and we find out that that is the maximum of samples, which is actually something similar that is a similar finding to the one that is the test that for pooling that got recently approved by the FDA for Quest Diagnostics.
Thank you, Carla. We have a question about, well, it starts with a comment. It says, each of you is, thank you for living ut prosim and for sharing your story. And they would like to know, are there current or future students who are interested, if there are, in the various aspects of this research? How can they get involved with you?
Well, we currently have a couple of undergraduate students in our lab volunteering. So I think 1 or 2 of them are actually doing this for course credit, and their job is to sort of continue to maximize the efficiency of our production of these alternative N95s. So yeah, lots of opportunities to volunteer and get engaged. We had, again, during the height of all of this, we had a number of people volunteering by just printing the design files that were available and then distributing them. But yeah, in the manufacturing space, all of our faculty in the engineering and sciences who are engaged have lots of space in their lab to get people involved and think about the next, what to do next to respond even faster.
Yeah, we were thinking about having some kind of short internships. We have this new facility that is absolutely a dream lab, has some additional space where we can have interns that can train on the techniques that we use and get a sense of what is working with some robotic systems. That is something that you don't usually have access to.
Here's a question, I guess either Carla and or Harry could take it. The question was asked, were you able to patent your testing technology?
That was never a consideration. We're not in it for the money. And frankly, as Carla said many times, this isn't rocket science. We're actually we're using methodology that's generally used to isolate and identify RNA. The only thing proprietary and barely proprietary is the so-called primers, the address marks with which we fish out the particularly viral RNA. So I think the accomplishment is much more intellectual and implementational than something that should be patented. And again, you just end up with another kit, and that's just not what we're about.
Okay, thank you, Harry. Next question for all the panelists says, as Dr. Friedlander suggested, at some point the COVID crisis will be behind us. Without that obvious imperative, will it be possible to mobilize this amazing creative energy to solve another significant problem? And how would you go about doing that? How will you identify the next problem? Thoughts?
Well, see, I was thinking when I mentioned the agility of a land-grant university such as Virginia Tech, the next problem may not be biological. It could be, you know, what if we had another nuclear event or something like that? What we have a tremendous water shortage? What if we have earthquakes? Whatever we might have, you know, we have expertise in every single area, from geosciences to physics, math, to biomedical sciences. So I think we have to learn about agility and partnership and teamwork across all the things we do, not thinking about the next virus. The next challenge may be something we don't even yet know exists.
I think there is, I think you have a piece of data that I think is, I know that you have it, and I think it's worth to pass to the public. Do you think you can share how many businesses we help as well? You're muted.
Yes, I think I can, Carla.
Yeah, I know that you have that data. And it just
without naming them though.
Right.
So we recently had occasion to talk to our good friends and colleagues at the health districts, particularly New River and Roanoke, Allegheny. And actually for part of the report, through the support we get from Go Virginia, they were curious how many local private businesses were supported through this. So I want to emphasize, we don't deal directly with businesses. It's the health districts that go out and collect samples, but they do. Nursing homes, congregate living facilities, doctors' offices, nurseries, schools, etc. Anyway, as Carla is alluding to, we just learned the other day, because we don't really know when the samples are coming in, that we've actually been able to help between 650 and 700 businesses in the region through this testing. So we were very pleased to see the level of impact that it's having. I'm glad you brought that up, Carla. Next question, I want to make sure to get this one on before we run out of time. The comment is made that you all have diverse backgrounds, and what does that add to what you've accomplished? And I'm interpreting this in terms of diversity across the scale. You know, it's techniques, where you are learners, professors, etc., but also different backgrounds, people from different countries. You want to say something about that? Because I know these are very diverse teams.
Yeah, one of the things I want to point out that our early team, 12 people, 8 of those are foreign-born individuals. That includes Carlo Finkelstein and me. It reflects of who we are in academia. We're global, we're international, we're very integrated, and people bring different viewpoints, not just different education, different philosophy, different viewpoints, different approaches that greatly affect the outcome of what we do. So I do want to acknowledge that, you know, we were relying a lot of global impact on what we were doing.
Yeah, that's true.
Okay, let's see. There's a question here about what will be the therapeutic area of focus once the pandemic is behind us. Now, I realize and appreciate that you all aren't necessarily working on therapeutics, but as you know, we all know we have a number of colleagues that are as well.
Yeah.
Would any of you like to comment on that?
I think the beauty with viruses is that, you know, sooner or later, you know, we have a very powerful immune system. Sooner or later, our population will develop what everybody talks about, herd immunity, and it will become a disease such like the flu, where we're actually trying to protect the vulnerable, who because of their age have a tired immune system and can't mount the same immune response. But I think the impact of a disease like that will diminish over time as our population actually gets exposed to that and their immune system develops immunity to it.
Good point. Well, we're very close to the end, and I think I'll take the last 2 minutes here to just read you a couple comments, not questions we got from the audience. One of them says, "Congratulations on your success. It is a great example of teamwork across disciplines to accomplish a broader purpose. As the pandemic passes someday, would encourage you to continue this model of teamwork. It is a great example for students for when they go to their workplaces, not to be in a silo in their own roles, so common with industry. Thank you, and go Hokies."
Yep.
So perhaps that's a fitting ending. I just want to thank all of our panelists, Harry and Carla and Chris, for all the work you've done, and all those people, some of whom got mentioned, many of whom didn't get mentioned, that have made all this happen. And I also want to take this time to thank the audience for participating in this. We hope you learned something a bit more about Utprosim and the Hokie spirit, what's going on here. And we look forward to sharing more of this with you in the future. And Debbie, I can turn it over to you for any closing comments. Thank you.
Thank you very much.
Thank you.
I just want to thank everybody for attending this evening. We've gotten some great comments. I've got some people texting in and telling me how much they enjoyed it. We've seen a lot of our volunteers and board members and just interested Hokies from across the country. Thank you all so much to our panelists and moderator, Mike. This has been absolutely fantastic, and I just am so appreciative of not only the work that you all are doing, but your willingness to take the time to share with the Hokie Nation. So thank you all. We will try to get some answers to other questions that we didn't get to out to you all in a follow-up email, and we just hope you have a great evening. Go Hokies.
Go Hokies.
Okay.
Thank you. Bye, everybody.
Bye-bye.